Okay, so myofascial, really important before you're applying a lubricant. Otherwise, it's going to be really hard. You'll be fighting your own muscles to try not to slide too much. But once we move on to our typical Swedish, I always like to make sure I've got lubricant on my forearms, also my palms. I start by turning my arms back. That way I'm not laying cold lotion on them. And I introduce with the larger, warmer part of my arm, and then introduce the lotion. Going back to Swedish, exactly what pattern you follow here doesn't really matter as long as you are making sure that you lubricate the entire back. If you find that I will often get a little bit more, I maintain contact while I warm. Make sure I've got it on both sides. But make sure I've got it evenly covered. At this point, it's been a while since you guys did Swedish and the trapezius. I always like to revisit. This is the general Swedish warm-up. I always like to revisit this trapezius work. It amazes me when I get to this point, and a lot of people are still not really coming into their ulnas. The trapezius, along with right into the erectors, is just a really powerful position, and you can really come at an angle. I've got maximum contact along that entire second head trapezius. Come through here. Bringing my tool between the vertebrae and the scapula in this position. As the scapula falls away, I rotate so that I've got maximum coverage of the entire side of the back.
I think I put too much lotion on.
Most people are probably still using too much lotion. Lighten up and glide back. My main pressure is towards the back of the body and down. Remember most of the postural distortions we saw in the pictures and slides today? I'm just going to stand up for a minute, break contact. Everybody's always hunched down, hunched forward. And with technique and technology, it's just getting worse and worse and worse. If I was to do most of my good deep strokes this direction, I'm just driving her more into that body position. If I go this way, I imagine I'm peeling her up and back. Peeling her up and backwards, and then creating that extension in her spine through the long gliding stroke. This stroke is one of my very first strokes on the back. It's not the first. You want to make sure you spread the lotion, warm up a little bit. But it's one of my very first because it is so broadly effective. Also, this is the position where I can bring maximum pressure. And so I can be in here, I'm early in, check in. Would you like more or less pressure? Would you like more or less pressure?
Oh, that's fine.
Great. Now, if I just say, but what am I not going to say?
How's that?
How's that? And then just leave it. Because there's an automated response. How's that?
Fine.
It's good.
It's fine.
It's fine. There's an automatic response even if it's not fine. Right? So I usually do ask, how's that pressure? It's good. And then I follow up with, would you like more or less? Oh, no, it's fine. Okay, now I believe them. But then I'll also typically follow up with, if at any time you'd like more or less, go ahead and please let me know. All right, we're going to make sure we're maximizing. All right, also, general warm-up. Soft fist, I'm doing double-sided. The thumb is the leader on my soft fist. That maximizes my elbow strength. My Barbie arms. Russian. When I'm doing Russian here, I'm going to alternate. If I come together too much, I don't want to pinch the skin there. But if I alternate, I can go both sides, or I could stand to one side. This hand now allows me to palpate the spinous process and make sure I'm working the tissue. I tend to work it away from the vertebral column, but we'll talk about in a moment why that's not always the best answer. If I have a person who's got really, really tight upper area here, just a quick reminder, Russian is great for the traps, but if you got people with excess tension, you can hook that against your hip, straighten the tool, and you can use your body motion for the tool. Gives you a lot of pressure for those hard-bodied people, but you're not overusing and compromising your own hands. Okay. All right. So I have a couple of new relaxation techniques to show you. One of them is caterpillar. So you know Russian? Some of you are still practicing this Russian thing. If I stick them together, it becomes my caterpillar. So I'll go up one side of the erectors and down the other. Elena, do you see the caterpillar? Does it look like a caterpillar?
I'm trying to, yeah, it does. I'm just trying to imitate you on my leg.
Now you can go up one side, down the other, or you could, go down, circle back, whatever. But that's my caterpillar. I'll just do it really fast over here so you guys can see on the side as well what it looks like.
The baby looking like a worm.
It's a little walking caterpillar. Up the mountain, down the mountain. First time I review lamina groove. Remember, lamina groove, everybody gets it. Swedish, relaxing, just do it lighter. Deeper, work your way in. But traditionally, I use my plow. Slightly curved fingers for strength. Alternating fingers makes a nice plow blade. Welcome to Indiana. We plow fields. I start right at C7. Any higher, and I would smash their neck and their head into the headrest. That does not feel good. C7, though, is a good place to start. One hand is touching the vertebrae, one hand is touching the muscle, and just like a plow going through a field, separating the dirt, I am separating and pushing the muscle away from the vertebral column. The first line I do here is going to be, it's relatively speaking to how deep we can go. It's not that deep. Although it might feel deep to them because it's the first pass on that superficial layer. But the plow is a technique that if you're in a good hand position, you should be able to do multiple times. For those of you who don't have good finger integrity, stacked thumbs works really well. You can use a single thumb. If you use a thumb, bend it over your fist. Don't let it slide out and hyperextend. That's not going to be a good long-term solution for you. That could compromise your joint and your career. Bend it over your thumb to protect yourself, to protect your career. Once I've got that, I can stack my other thumb over it. Now I've got good protected thumbs, but even more power. So I can go down through there. Notice my thumbs are not the knuckles aren't turning white or all wrinkly. If your knuckles, I'll do it on purpose. See how the knuckles turn white when I'm in hyperextension? That's a bad sign. If they're nice and just the same color as my hands, then I know I'm protected. Notice how the tissue, if you watch right here, is starting to condense right in front of me because of the pressure I'm bringing. If the thumbs also don't work for you, you can use the locked knuckle. Remember that one? We stick a finger out, we bend it, we lock it in place with the thumb. For that one, because we want to avoid bone-to-bone contact, I'm always going to use my other hand as a guide to make sure I'm staying in that proper lamina groove and I'm not accidentally raking my knuckle against her spinous processes. That'll light her nervous system up like a Christmas tree. She's not going to like that. Okay? So you can use whichever plow tool you like, but we've already covered it's so many muscles attached to the spinous processes, and that's essential for working all of them. So whatever therapy focus you're using, make sure plow is a part of it. Up the mountain, down the mountain. That's part of the new. So my thumbs kind of together, but they're on opposite sides of the vertebrae. As I glide down, they push the tissue away opposite directions. Come back up. Down and out, back up. Down and out, back up. It's a beautiful butterfly.
So it's kind of like you're pushing the muscle away.
I'm pushing the muscle away on both sides, but I'm using my body weight to do it as I lean in.
Are you stacking like stacked like
Well,
that?
my fingers are just kickstands, and I'm just keeping my thumbs slightly bent so that if they start to hyperextend, I've gone too far.
Yeah. Okay.
I'm just going down the vertebrae into the lamina groove, and that's it.
Okay.
Call that up the mountain, down the mountain, but call whatever you want. Okay. So for the erectors, we have the erectors laying like I imagine those long summer sausages you can buy at like Menards. They're gluten-free. Cut them in half, split it, and lay it on both sides of the spine, and you've got these big tubes of muscle that run all the way up down the back, the whole erector spinate group. We know in that group we've got three superficial muscles, iliocostalis, longissimus, spinalis, semispinalis, running all the way across there. But we're going to treat them as a group. of like in the forearms, we treat all the extensors together, all the flexors together, okay? So I can come to one side of the body and I can press, so I'm in the lamina groove and I'm pressing the tissue away, working my way down the vertebral column. And do that on both sides. This is not any specific therapeutic goal. This is just meant to release and mobilize the group as a whole. Likewise, I can come to the outside of that big band of sausage and work it towards the lamina. Notice, like right there, that's that. She doesn't have a big, thick piece of sausage. Hers is more like beef jerky. But see, if I push right here, how it pops up, that's the muscles being pushed up into the lamina groove. There it is. In the back, it's always thicker. See how much thicker it is down here in the back from where I was at before? If you have, again, problem with finger integrity, you can do this with thumbs. Okay. Now we're going to start moving into more of a assessment and treatment model. So if we got somebody with hyperkyphosis, hyperlordosis, we're not going to diagnose them. We're not going to tell them all these amazing things, but we can kind of look and see during the intake is when this starts. We're just kind of generally viewing their body structure as they're telling us about their problems, as they're walking down the hall with us to the room, and even when they're on the table. Remember, when they're on the table, their body structure is going to be different. But people who have a severe hyperlordosis are going to have a severe hyperlordosis when they're on the table too. So, if we want to move, and this is important terminology, we don't manipulate bones for the sake of manipulating bones. Those are other specialties. But sometimes we move bones in order to affect the muscles and the fascia. Just like, remember back on bicep, we were always straightening their elbow to affect bicep. Moving the elbow is not my goal. I'm using the elbow movement to affect something else. Also, sometimes we know that, for example, vertebrae are out of position because the muscles and fascia beside them are tight. And so they're pulling the bones out of position. My goal is not to adjust bones, but if I release the soft tissue spasms or tight fascia beside the vertebrae, then what is likely to happen to the vertebrae? They're likely to just slide back into their standard position. This is the foundation if you're looking for CU courses down the road. Eric Dalton is a producer. He does a whole program called Myoskeletal Realignment. It's allowing the skeleton to realign through adjusting the muscles and fascia. So some of what I'm about to show you comes from that. We have the entire course up front if you want to just like glance and flip through it. Anyway, so hyperlordosis. If we have a hyperlordotic curve, what type of curve is that?
Anterior.
It is towards the anterior. Okay, multiple choice. Concave or convex? Concave. And two sections of the vertebral column are supposed to have a concave curvature. It's the low back, makes sense because lordo sounds like lumbar or low back, and then the mirror is in the neck. We'll have mentions of that, how that happens developmentally. And those curvatures are both healthy and normal, but people can have excessive curvature. A lot of times there's lots of contributing factors, weak abs, allowing the vertebrae to penetrate forward. Could also be really excessively tight erectors and QL. We talked about how those can cause extension of that section. So you've probably, up to this point, always been working the muscle kind of away from the spine or towards the spine. We tend to get habits of always doing the same thing. But we can work the muscle with more intent. If somebody has hyperlordosis, their vertebrae are shoved deep into the body. One way to encourage them to move posteriorly is to remove the soft tissue that's pushing on it. And so we move that tissue laterally. So by working, and she doesn't have a hyperlordosis, so I'm just going to kind of fake it. But if I move the tissue and my focus is not to equally move it in and out, but to move it mostly laterally, I move the pressure away from the vertebrae, and that lack of pressure allows the vertebrae to start to move more superficial, more posteriorly. Which over time, I would never, I'm not going to say, oh, come on in, you've got hyperlordosis? Sure, give me half an hour, I'll take care of that for you. I do know therapists who are that blatant. I don't recommend it. If I work posteriorly, that's to cause if I work from medial to lateral, that's to cause a posterior movement of the vertebrae over time. Of course, allowing for other factors. You guys looked at the protocol. My protocol mentions bury the zombie